All right, everybody, we're back for standing strength and activating through the core and through the hip in a mindful way that is going to enhance our standing strength. Take a second just to acknowledge the good in your life. I believe that we are always in a hurry to get to the stuff, and mindfulness and acknowledging gratitude is such a beautiful practice before we do anything. I often call it a threshold before we change gears or shift gears or go on to the next task, just to stop for a second and be grateful. So, I'm grateful for you. All right, here we go. We're going to talk about standing strength. Now, I have a chair, which I recommend always having a chair nearby just for support. You know, we're trying to regain some of this stuff. So, the first thing I want you to do is put your hands on your beautiful hips, the one that is new to your body and your original, or maybe you have two new ones. Whatever you're doing, put a little bit of good juju in there, a little bit of good energy, and know that we together are going to get strong. So, the first thing we're going to do is some heel raises. We're going to bring some heat into our calves. So, I'm holding onto a chair. I'm going to lift up and lower. Now, just follow along with me. This is a great thing to bring some strength back into your calves. You can hold on to a wall, you can hold on to your sofa. We're just going to do 3 more. Up and down. That's all we're doing. Up and down. Hold on to those hips if you want to. Always coming back to loving the new and the old. All right, last one. I'm going to take my feet a little bit wider and my toes are turned out slightly, not much. We're not looking for a big wide thing, just a slight thing. I'm going to hold on to my chair. I'm going to bend my knees, come into a baby squat, and then rise. Now, humbling, yes. I used to teach barbell classes, with the heavy barbells and deep squats, hands on the hips. But life changes, right? Life changes. So we come to what we know. Let's just do 2 more. You can feel that, right? A little bit of heat in the legs. Last one. Let's just do 1 more for good measure. Now I'm going to take my feet close together again. They're not touching, but they're directly under my hips, holding onto my chair. Affected leg. I'm going to sweep it up and then lower it. So similar to the feeling that we get with the heel slides that we did in episode 1, lifting and lowering. Now I feel this in my core that I've activated, my hip flexor that's cranky. 1 more, and then release. So as I do that, I have a tendency to dump into my right hip because it's my stronger hip, but I want to make sure, I wore the wrong shirt for this. I want to make sure that I'm activating through the right cheek so that I'm not dumping like this. I want to stand tall like this. We're going to take the leg. Now your leg might be your right one, so I hope you're doing the leg that you've had surgery on. Holding onto a chair, I'm going to sweep the leg out and squeeze it in. Sweep it out and squeeze it in. I can feel that. Okay, 3 more. It's hard. Squeeze the belly. 2, last one, and draw it close. I can feel it also in my right cheek. I'm going to turn just so you can see where we're going to go, but I'm going to hold on to the chair and I'm going to take my affected leg. I'm going to bring my heel up and I'm just going to do like a little donkey kick back there, squeezing the buns, kick and pull in, kick and pull in. So this is working the back. I had a posterior hip replacement and then 2 revisions. So my incision is right here. I'm squeezing the bun. 1 more. And then release. Now, for me, when I do that, I really want to lean into my right leg. So my work is to do it just like that, standing tall. Okay, so you have to have that body awareness. And maybe you do it in front of a mirror or a sliding glass window where you can see your reflection. Or maybe you just tune into the right side. Am I dumping into my unaffected side? Am I leaning too much on my stronger side? We want to make sure that we're equal and even. Now, the last exercise for standing strength, holding onto a chair if you need to, I'm going to take my affected leg. This one's hard for me. It's really hard. I'm going to bend my knee. Oh, knee is going to come up. Now, I can't do this yet. And then down. So I'm going to show you with my unaffected leg, up and down, up and down. So that takes a lot of strength in the hip flexor. So I'm going to use my hand to support and lower because I want this leg to get stronger. If I just say, oh, I can't do that, then I quit, I'm not going to help myself out. So I'm going to use my arm. And then maybe after I have done this for 5, 6, 7 days, I'll be able to lift it and lower it. It's really hard, you guys. I get it. It's really hard. It's humbling. It is absolutely humbling. But together, we can do this. And I know that we've all been in physical therapy, we've all done all the things, but this awareness of what's going on, head, heart, unaffected side, and we weave it together, I think that we can find strength again. That's my hope. That's my hope. So find a chair, tune into your hips. I try to put a little love in my hips all the time. I talk to my new hip and tell her it's okay. It's okay. I talk to her a lot. And then do some of these standing exercises. Do some of the adductors. Do some of the sweeps. Do the sweeps. Do the lifts. Do the squats. Do the heel raises. And do it for a week or so. And then be aware of your progress. Hopefully, after a week, these exercises get a little easier. Now, remember, episode 1 is all about that activation. This one is all about standing strength. So stay tuned. There's more. I'll see you.